getting nutritionally ready to recover from injury is super important. What I see clinically a lot is that, especially patients middle age, certainly older age, they'll come in with more chronic inflammation, especially people that have something like an autoimmune disorder, like rheumatoid arthritis, psoriatic arthritis, name the autoimmune disease. An anti-inflammatory diet is really important. Getting into some of the science, if you look at high soluble fiber, that is the diet that can actually reduce inflammation. And for every 10-gram increase in soluble fiber that you get about a 10% decrease in atherosclerotic disease, which affects stroke, heart attack, peripheral artery disease.
Welcome to the podcast with me, your host, Dr. Debra Durst, and I have a guest that's back with me by popular demand, and it's Dr. Spencer. So, hello, Dr. Spencer, and thank you for coming back on.
Thank you, Dr. Durst. I appreciate that. I don't know about popular demand, but
well, we have all the back-end comments that we know.
Yeah, I'll take that.
Yeah. So what we were going to talk about today, and again, I think that already applies to surgery, and you have a huge passion for nutrition. So we're going to talk about anti-inflammatory diets, because that applies to not only surgical recovery, but also just in general longevity and how to decrease the already existing inflammation in our bodies. So I'm going to just start by saying again, what are your thoughts on inflammation that is pre-existing as we get older, and if we haven't really addressed nutrition on a more serious level?
Right. So there's so much that we can do through nutrition, and as we talked about on a previous podcast, just getting nutritionally ready for surgery, getting nutritionally ready to recover from injury is super important. We've kind of talked about the high protein diet, how important that is for tendon and muscle health. But what I see clinically a lot is that, especially patients middle age, certainly older age, they'll come in with more chronic inflammation, and it's some of these patients will come in, and you can kind of see what metabolic syndrome looks like, right? I think there's 5 things that you have to hit. 3 out of the 5 to be classified as metabolic syndrome. It's like HDL lower than 50 for men, and LDL above maybe 180, glucose
And
I think
then
like
even think about
120,
yeah,
and then you got the visceral fat that you can see, and then think hypertension. So I think if you hit 3 out of the 5, then you get diagnosed as metabolic syndrome. Most of those patients, if you get a sedimentation rate, C-reactive protein, you're going to see that they're chronically inflamed. Clinically, what do we see is kind of pain all over, and there may be, I haven't looked into this, so I don't know the data, but there may be a component of fibromyalgia that is from that, like a little branch of that. But what I'll see is patients that have like lateral condylitis, rotator cuff, things that are just an itis. And yeah, it's okay to treat that with anti-inflammatories, and we do that a lot. But there are things that you can do nutritionally, especially people that have something like an autoimmune disorder, like rheumatoid arthritis, psoriatic arthritis, name the autoimmune disease. An anti-inflammatory diet is really important. And traditionally, people will sort of think about like Mediterranean diets, and it's true. I think it's really good for you. But getting into some of the science, if you look at high soluble fiber, that is the diet that can actually reduce inflammation. And there's actually really good data on why that works. And so in general, I think most Americans get about 15 grams of soluble fiber a day. For every 10 gram, I'll take a little diversion here. For every 10 gram increase in soluble fiber that you get about a 10% decrease in atherosclerotic disease, which affects stroke, heart attack, peripheral artery disease. But if the soluble fiber is a prebiotic, that's what your bacteria use, the gut microbiome that people talk about all the time. Critically important. And the bacteria use the soluble fiber as their fuel source, as their food, and they turn that into short-chain fatty acids. And one of the short-chain fatty acids is propionic acid, which actually inhibits HMG-CoA reductase, which is what the statin drugs, many of the statin drugs inhibit that. So you can actually reduce your cholesterol and triglycerides by doing that. And in addition, it decreases the cholesterol absorption and things like that. But then one of the other things that you can do, so this is on a handout that I give to a lot of patients, is omega-3 fatty acids. And so, the omega-6s are pro-inflammatory, the omega-3s are anti-inflammatory for the most part. And the omega, I don't know how far in the science you want me to go, but I like backing it up with something other than do this and it'll make you feel better. But
Well, I even think that if we started, like, there's a lot to, unpack and unravel, or, just unpack and talk about there. So, metabolic syndrome, for instance, like, you can tell, like you're telling me symptoms that the patients or presenting, signs, symptoms, or conditions. But you can tell when they have metabolic syndrome when they walk in the door. And you're looking at, again, increased waist circumference, right? So just so people have an overall idea that as we're just walking through daily life, you can kind of see that we're starting to age, things are changing, and then there's a weight gain, which results in all the cholesterol. So what you're talking about is those parameters from labs that we're looking at that diagnose it, but you really can kind of tell just when you see, and I think waist circumference might be one of the things too, and then high blood pressure, those simple things. But then you're seeing the presenting condition. So metabolic syndrome being one of the issues to unpack. But then you're talking about fiber, and again, it sounds like fish oil too. So
and the omega-3s it's really important to get high DHA and high EPA. It's not, so you can look at some of the fish oils and see a breakdown where it may only be like 250 milligrams. You really need to be at like 800 milligrams or a gram of DHA and EPA, because we get omega-6s all the time. We get that in our diet all the time. And that goes down the inflammatory line. And to get a little sciencey, that's the arachidonic acid, which gets turned into prostaglandins. And so the same enzymes that work on the omega-3s work on the omega-6s. So if you have an overabundance of omega-3s, then you're going to be going down that line as opposed to the omega-6 line. And the omega-3s, it's really hard to get that just by diet. I mean, if you ate salmon every other day, then you could potentially do that. But it's hard to do that. And nutritionally being smart is not inexpensive. It's not an easy thing to do. You have to be really intentional, and you have to be focused on what you should and shouldn't eat. And it's not a bunch of, I don't want to create a whole set of rules, but I want to provide a little bit of science of why it does work. And the omega-3s are super important for brain health. I mean, our brains are mostly like fat and water, right? You got the myelin sheaths. That's where the omega-3s come in. And I mean, there's some data to show that it actually reduces depression as well. So, I mean, there's all kinds of benefits to taking that. And so I try, especially if the patients seem to have metabolic syndrome, insulin resistance, and insulin resistance in and of itself increases inflammation. Let's just do some dietary things. Let's just do some nutritional things that I think will help out. And it's easy. It's low-hanging fruit.
And
right?
so you basically are providing your patients with a guideline of things you should do to decrease inflammation in the body. And so again, you're talking Mediterranean diet, in those dietary ways to decrease inflammation and increase omega-3s, because that's mainly fish, and fish intake, which is protein.
Yeah.
But then you would recommend, and you do recommend supplementing, usually with omega-3s, or again, omegas in general. They have a ratio that is natural, even if you're, and what's the gram that you recommend? You said at least 1 gram a day as a supplemental?
Yeah. So I think the best would be a gram of DHA and EPA. We get, as far as the omega-3s go, we get ALA in our vegetables, really. And so we don't really have to work to get that, but you've got to work and be intentional about getting the DHA and EPA. And it is markedly beneficial for cardiac health as well as brain health. And like I said, I mean, there's some good data out there to show that it can actually improve bipolar disorder, depression. So plenty of things, plenty of reasons to take that,
I actually think that fish oil is one of the most important supplements that a patient can be on. Again, for all the benefits that you talked about, brain health, but also just reducing cholesterol. Like when we talk about statins, I think fish oil should be the first step. And then even if you're on a statin or you're starting a statin at the same time, fish oil is one of those. But it is one of those supplements that I say you should be very careful about where you source that. And medical grade is important because, again, it does go rancid pretty fast. And just knowing you're getting a fish oil that doesn't taste fishy, because it doesn't have to, But I highly am behind you there. That's one of the most important. And so then it sounds like fiber is another thing that you recommend.
Yeah, a high soluble fiber diet is critically important. Again, anything we can do to reduce our triglycerides is going to be beneficial. The cholesterol intake that we have really doesn't matter. So the dietary cholesterol that we take in, very little of it, maybe 10% of that. 10% of that's actually absorbed. The rest of it's just excreted. But we get the triglycerides and we get the carbohydrates that are turned into cholesterol. So if we can do something to reduce that, then you're going to reduce your overall inflammation because, like I said, that leads to metabolic syndrome. And there's a cost for the metabolic syndrome, not only a financial cost, but there's a life cost. So our average life expectancy here in the U.S. is about 80, right? And there's a 20-year cost. So the average life expectancy for someone with metabolic syndrome and insulin resistance is 60. So if for no other reason, do it for yourself, but then there's a financial burden that's placed on all of us, right? So that should be considered as well. And if you can do something easy like reducing the refined sugars, certainly reducing fructose, you're going to reduce that insulin resistance, and that's I think more the key than anything. It's not so much the glucose, it's the insulin resistance, it's the insulin spike, and you'll see patients with metabolic syndrome and insulin resistance much higher rates of cancer because that increase in insulin increases the growth and doesn't allow us to be in a state of cellular autophagy, like we were just talking about before offline. When you do fasting, intermittent fasting, any kind of time restricted eating, it allows your cells to clean up. So, and this is going on to the lifespan thing. So cells that are dividing and continually growing, if you're always on growth hormone, if you always have insulin, those are things that drive cellular growth and division. We need time to not do that. We need time for the cells to actually clean up, and that's called cellular autophagy. And so the cell will use its little lysosomes and clean up the debris. You reduce plaques in the brain, and you increase your longevity. And there are some people that actually take, and I don't know how deep you want to go, there are some people that actually take rapamycin now just to induce some of that cellular autophagy and reduce the mTOR so that you can allow the cells to clean up, and that reduces the risk of cancer. And that may be a little bit much taking rapamycin, but I know that there's people that do it.
There's been some podcasts I've listened to with that, but I think that even just that fasting, simple things we can do and simple supplements, and again, talking about inflammation in the body, as we get older, that weight gain is inflammation. You can see that the blood pressure, like everything that happens as we get older. And again, I would go back to, that hormone optimization or just optimizing the body decreases inflammation. But again, I love the fact that you are doing surgery and you're surgical, and now you're looking at all the effects that it can have. And obviously surgery alone is inflammation too, and stress on the body and increasing cortisol. And and again, every time I see somebody with high cholesterol, it's fish oil first, and then the two things I say is you need fish oil, and it's sugars and it's not fats that causes that. So, and again, the other thing that you say that I just again say, cholesterol's, at the scene of the crime, but not the culprit, because it's really inflammation, even when it comes to cardiovascular disease. But again, I think fiber is one that maybe I'm not talking about on a daily basis, but, protein intake, which we'll get to because we both feel strongly about that, we will. So when it comes to fiber, you're saying at least 10 grams.
I go for 50 grams,
Okay.
50 to 60 grams of soluble fiber, and I like to do that in smoothies because I think getting the fresh fruit. Now, we talked about fructose, high fructose being, we kind of touched on that being a bad thing, and we can come back and talk about that a little bit later. But the fructose in fruit it's the same fructose, it's the same molecule, but we don't absorb as much of that. So when you're taking in fruit and vegetables, you get insoluble fiber, which coats the intestine, it coats the duodenum, and then you get the soluble fiber that helps coat that as well. So a lot of those nutrients go on down to the jejunum, which is where the microbiome is, and so you're feeding the bacteria, and those bacteria need to be fed so they can create those short chain fatty acids and actually work for us. Because if you don't feed them, they will feed on you. So they're going to feed on your intestinal lining. So the soluble fiber does so much as far as allowing your bacteria to be fed, but allowing us to take in the good nutrients. And so some of the food that you eat, like if you count the calories at your mouth, that's not necessarily the calories that you're going to be taking in. Now, a calorie is still a calorie. It's a unit of energy, right? But the type of calorie is totally different, right? So if you're taking in refined sugars, you're going to absorb that straight away. But when you're taking in sugar that's in fruit or vegetables, you don't get as much of that. And there's a thermic effect of food that you're familiar with, and we can touch on that a little bit later. This has something to do with but this is actually more just how many calories does your gut actually take in and you get from that fruit. But the soluble fiber is super key for reducing inflammation.
More complex, so it's again a complex carbohydrate, just slower increase in your blood sugar, and again better for your gut lining and the bacteria there. And you talked a little bit even about the prebiotic versus like a probiotic, because I'm not sure whether you recommend a pro, but like the pre meaning, and maybe getting into that a little bit, because I know a lot of people talk about pro, but maybe
Right.
not so much about pre and feeding, that good bacteria.
Right. So I do actually all three. I do a probiotic and postbiotic. I just started taking postbiotics, which is the actually drinking the short chain fatty acids. So that's the fermented foods like kombucha and stuff like that. Some of them are tasty, some of them not so tasty. So you can choose whether you're going to take that or not. But that's kind of the food for the gut epithelium is the postbiotic, and so that's the stuff that the bacteria make. So in my smoothie, I put in. You don't have to do what I do. This is just what I do. I've been doing it for years. I've just gotten used to it. But the soluble fiber is the prebiotic, and then you can have probiotics that you can put yogurt in there. Greek yogurt is really good, high protein. It's got probiotic. It's got probiotics in there, and then I've got some protein powder that has probiotics in there as well. And so I do a little bit of all of it. And so I think that helps.
Is resist? I don't know that I've heard or read a lot about the post biotic. Again, if I'm saying so, but is a resistant starch along those lines, or not?
It's the short chain fatty acids. So
Okay.
it's the fermentation process in the food that creates those short chain fatty acids. So like butyric acid, propionic acid, acetic acid. So that it doesn't necessarily feed the gut biome, although it can. It's more for the epithelium. So some of the short chain fatty acids, like butyric acid, is used by the epithelium. So you're actually just feeding the gut epithelium.
And when we're talking about the GI tract, again, so I love the GI stuff just because you have a full, huge organ and system there that is a one layer system keeping the outside world from the inside, because everything that goes through the GI tract is elimination. Food, and it's processed and metabolized and absorbed. But again, if that one, epithelial layer has the wrong bacteria on it, then that epithelial layer gets leaky. And then the first thing you get is inflammation, but then you get an immune response, which goes back to some of those things that you were seeing clinically when they come in, the lateral epicondylitis, like all of those, big words that I'm having trouble with obviously today. But anyhow, I think that those are the things you're seeing, but you can also see, like you said, the autoimmune diseases, that are just a step further, but a lot of it's GI in origin, because of the things you're talking about, not
Yeah.
having a healthy GI tract, but also not having the right bacteria there,
Yeah,
which is huge.
I've read quite a bit about that leaky gut just because I find it interesting, and sometimes I'll just go off on all these little tangents. But I find it interesting that it can create inflammation, and because as opposed to, as you said, having that nice seal, now we're having stuff from this sewer, right? Get into our bloodstream that can't possibly be good, right?
Correct.
and we're not absorbing all the nutrients that we could absorb out of the food.
Well, and then there's such toxins that we're exposed to. And again, if we're in the inner part of the grocery store versus the outer perimeter, then you're talking about processed foods and all the toxins that are there in the processed foods. And then they sit because historically, animals, they eat and they eliminate. They eat and they eliminate. But humans, as we have, again, developed bad eating habits and maybe not the right supplements, again, it sits in our GI tract for a long period of time. And then the toxins also can be basically absorbed, and also inflammation. And then, that's where the immune response, comes into it. But it's interesting because, again, you look at derm issues even in addition to joint and autoimmune, and a lot of it's GI and source, because of the things that are going wrong in the GI tract. So,
Right. And I think really I guess is a double entendre. The low hanging fruit is like fruit and vegetables.
Yeah,
because
nutrition.
again, and this is a big meta-analysis, when you look at just increasing your dietary fiber by about 10 grams, you reduce your risk of cardiovascular disease, and that's a function of reducing the triglycerides, and that's a function of the gut health. So all of it kind of compounds each other, and what I see clinically is I'm just uncomfortable all over. And it's amazing how much better you can feel when you just do those kind of simple steps. You know what I mean? And the other thing is vitamin D, and I was just reading about this. Vitamin D is a great supplement, and I take 5,000 units every day. We try to stay somewhere, was it between 30 and 90, 30
actually,
and 100?
80 to 100, ideally.
Okay.
Yeah.
That's pretty high. I don't see a lot of my patients there, but
Yeah.
I check vitamin D, I check albumin, many times DEXA scans if we're going to do an arthroplasty of some sort, because I want to make sure that they're nutritionally ready to do this. I want to make sure they've got good bone health. But the vitamin D that we take is a pro hormone, right? And so it's got to be converted by the liver to dehydroxy 25 vitamin D, I think, and then converted to the working vitamin D in the kidney to 1-hydroxylated, I think. But in inflammatory tissue, that gets converted to 24, 25, and then you just pee it out. And so getting that vitamin D to work for you is another function of not having inflammation. And there's, again, so many sources. The processed food that you talked about, most of that is the high fructose corn syrup, because fructose really is broken down to several different metabolites that decrease mitochondrial function, and that's kind of the heart of metabolic syndrome, the heart of I just don't have the energy, I just don't feel good, right? And not having that energy, there's not a supplement that you can take that's going to overcome those metabolites of fructose that are inhibiting the mitochondrial function to beta oxidized fat, to actually get the long chain fatty acids into the inner mitochondrial membrane, where it's actually utilized as fuel. So the nutritional stuff, the exercise is so much more important. After that, then we can talk about supplements. At the same time, we're talking about nutrition and exercise, making sure that you're hormonally in balance, as you were talking about before, I think is great. But then below that is supplements, potentially peptides and things like that. But you've got to get this house in order up top before we can actually talk about anything down here, right?
So, what kind of mountain do you have to climb when a patient comes into you? Because again, I'm not seeing your patients, but I can have a general understanding of, they're all coming to you with an injury of some sort, but then there's healthy, active, then they're maybe not healthy and active, but definitely responsive to recommendations, and then maybe, some that aren't as responsive. But the issue is you're giving them huge value with just lifestyle changes and recommendations. And what kind of time do you have to discuss, or is that why you kind of created an outline of what they should do? And you also have a website that educates them as well. So what kind of mountain is that? Like, do they respond real well? Do you have a lot of time? And what kind of time pre-op are you talking about? Because you really want them to be a little healthier, definitely aware and educated for sure.
Right.
But ideally, some changes even before you go to surgery.
Right. So there's, let me unpack that a little bit. So there's acute injuries where we don't have as much time to address that. And then there's more chronic injuries where we do have time to address that. And so I do spend time in clinic talking with patients, but I have a lot of write-ups and just finished up another article for CityView that's going to come out about just the science of your diet, trying to back that up with a little bit of why you should do these things.
Awesome.
Maybe if you've got this problem like diabetes, what kind of diet might be good for you, that type of deal. Some patients are responsive to it or like it, and the practice has sort of shifted to a lot of those patients. There are some things that for me are kind of we're not going to go beyond this conversation until you stop smoking, right? Because that will inhibit, I mean, we've got good data to show that it inhibits bone healing and even tendon healing by at least 50%. So just stopping some of the negative stuff is great. Now let's go to the next level. Let's talk about nutrition. All right, let's get your nutrition correct. And more people are responsive to that. There are some people who just tell me, go pound salt. I'm going to go somewhere else, which is okay. That's perfectly fine. My goal is to try to get you better, right? And we need to make sure that we get the playing field, get all the players on the playing field to make sure that we can actually score. It makes them more of an active participant. Anyone that's an active participant is going to do better mentally and physically. And so that's what I'm going for.
I love it.
It's not necessarily volume. It's actually just trying to do more of the comprehensive care. Although I'm not, checking hormone levels, I do check vitamin D, albumin, and things like that, just to make sure that again we've got the basics covered.
And we talked about that like one other time, just vitamin D, because I know at the time of surgery is very important. And again, I forget what the optimal that they were looking for, but I want to say it was 60. But anyhow, 80 to 100 is what we go for. And if we're seeing, any of your patients, then obviously we're following our patients every 3 months with vitamin D levels. But I think that's key. Like as you want to actually, you're passionate about it, it's coming out. And so you're working with patients, and patients are really probably coming to you because it resonates with them. And you want an overall, you want them healthier as well. And a lot of people don't take the time. A lot of doctors don't, but I always say it's a journey. It's not us treating with a treatment plan and them with the condition that we're treating. It's a journey. It's our part and their part. And so you're just giving them the tools that they could use to do their part and
Correct.
educate, which a lot of them don't have and value that. So it sounds like you're actually finding the right fits for you ultimately.
Right, and I think it's the right fit for the patient because they want to get better. As a matter of fact, we saw a guy today that he's really kind of nutritionally changed everything. He's like, man, this really feels good, and a lot of it is shopping at the outside of the grocery store as opposed to the inner portion where a lot of the processed foods are. And he feels great. He's like, I haven't felt this good in many years, which is fantastic. So I'm going to get him to write a testimonial. I mean, there was a guy 2 weeks ago that said the same thing, which is really, really nice. I mean, it really then underscores this is worthwhile, because sometimes you're like, maybe I'm just beating a dead horse here. But I think some people are really, it resonates with them, and those are the patients that you can really help. You know what I mean?
Well, and that's why I think I asked, what kind of mountain, because obviously, if the subset of patients were really unhealthy and you weren't getting a response, but I think when it becomes rewarding, and also I think patients then tend to hear too, and so those patients that want a different approach are going to come to you for that.
Did you say adhere? Because they adhere better to the physical therapy, to everything that you say. Once you get that buy-in, then they adhere to the treatment protocols, whether it's a PRP injection, whether it's surgery, whether it's physical therapy. Right. They're consistent. And consistency in a program beats anything, right? I mean, you've got all these, there's probably 10 different diets out there, and you'll have people that propose the carnivore. No, I'm vegan. No, I'm whatever. And they're very passionate about it, right? They're adamant that this is definitely the way. But if you choose a diet that you can only do for a month, that's not going to work, right? You need to be consistent with it. So you need to find something from a dietary standpoint that you can tolerate. Some people may be able to tolerate intermittent fasting. My stomach's sitting here grumbling right now. I'm not an intermittent faster. I'm kind of a snacker. I get like a kind of a slow protein infusion throughout the day, eating nuts and protein bars and stuff like that. But then I'll also eat dinner. I've never really tried intermittent fasting. When I have done it, it's been because I didn't want to. I just wouldn't have food available. But some people can do that and they really enjoy it and they like the way they feel. They like some of the fat burn that they get. And you kind of go into a ketogenic state. And so people really like that. And I think that's how it was first. I think that's how it was first developed is when was for seizures. They found that they had people not eating and they were seizure free. And the guy figured out things in the 1920s that it's because they're ketogenic. And so they put them on a ketogenic diet and about a third of them became seizure free. So again, there are diets that can be used to treat certain issues and certain problems, but you got to pick one that you can actually be consistent with. Now, could you switch like every 6 months, maybe do intermittent fasting, then do ketogenic, and then do low carb? Yeah, you could play around with it. You just have to be consistent with your diet and your nutrition, and then consistent with some sort of exercise program that, again, you don't abhor doing. Like if it's like, oh my God, I got to go to the gym. Well, it's not going to work. We got to pick something for you that you can actually stick to, right? That you find enjoyable. And it may be classes, right? Some people enjoy doing Orange Theory or P90X or something where they're in with a group. And there's lots of those things out there. So that's the other component of this that you have to do in order to recover from a musculoskeletal injury. In general, it's going to require some physical therapy. In general, it's going to be pretty long term. In general, that should then transition to some sort of routine exercise program. Lifestyle change. Right.
A complete lifestyle change. And so I think that consistency is probably in the reason why they adhere and are consistent because they feel better. And so sometimes it's just a matter, and they did studies way back with smokers. If the doctor actually told them to stop, they would, like 50% of them did, but they weren't having the conversations. And once they did, then it's different. And so if they have a conversation and then they feel better, the best reward system is for feeling better. You know, if they come to you, they have pain in an area, great. But if they feel better because of an overall comprehensive approach, that's easy to get the buy-in because they feel better. Right. And so I think it's just opening those conversations sometimes. And we talked about, like, I'm not, just so you know, like, again, we did a podcast on, again, the fasting and the benefits, but I
Was that
tried.
right about I read that. I don't know. Is that, you remember that from the ketogenic diet, how it started with
So it's been across, like, again, civilizations since the beginning of time, essentially. So we kind of did the origins of it, but it was like, it's present in every religion over a period of time, like every civilization, animal. So like
Jesus fasted 40 days.
Yeah, I didn't see that
amazing.
one, but yeah, so and basically I tried the 3-day because that was very popular. So far, it's not been my thing. Like, again, that was about 48 hours. No, it was about 24 to maybe 30 hours. I was pretty much done with that. And I do intermittent fast, but the full fast was not really for me. I do want to try it again at some point just because of the changes that happen a little later in that fast. But you don't even start to you're still metabolizing for the first 12 hours. And so you're really not even getting to the point where you're fat burning until greater than 12, 12 to 18. So you have to do it for at least 12. So there's some numbers. And then again, at 54, you start to increase your growth hormone and autophagy happens. And so there's different time frames, but you have to get way far out for that to happen. I don't know that I'll get there, but there are benefits. There's huge benefits to it. And I think that's just like an intermittent. If somebody commits to that once a month, or once every quarter or once a year, there's still that consistency or goal, of doing that. But yeah, it's interesting as you start to learn, but calorie restriction is all, longevity. There's lots of science to support, that, and that's part of the fasting. But the health benefits are great. But anyhow, so we're talking because, again, when it comes to fitness, they're a little more limited but you're having those conversations and what they should do, even with the fitness aspect of it.
Yes, I want them in the gym as soon as they can. So,
Okay.
I mean, I'm upper extremity surgeon, so in general, they'll be in a sling or something like that. But they can definitely go to the gym and get some zone 2 cardio, which the recommendation is probably to get it somewhere around 2 to 3 hours of zone 2 cardio. And you can do that on an elliptical machine, you can do that on a recumbent bike. But the circulating lactate, I think, is good. It's clearly good for the brain. It uses as a food source. And so there's all kinds of benefit of just getting some zone 2 cardio, not to mention the EPOC, the extra oxygen consumption that's afterwards and the burn that you get from that. But I'm a huge proponent of strength training as well. Trying to get each muscle group a couple times a week is a really, really good idea. And we try to transition folks into doing that as soon as whatever the malady is has healed, getting into a program of both strength training and doing some VO2 max, just trying to do some cardio, because there are incredible benefits to that. So from a longevity standpoint, the stronger you are, the healthier you're going to be. So the all-cause mortality rate is about 3.5 times greater for someone who's weaker than for someone who's stronger. And it's not just, they don't measure this like bench press. It's usually like grip strength or like doing a farmer's carry or something like that. But if you're in the top 5% versus bottom 5%, the all-cause mortality rate is 3.5 times less if you're in that top 5. VO2 max, it's even greater. I think it's like your all-cause mortality is like 7 times less if you're in that top VO2 max versus the bottom VO2 max. And so the cardio training really matters as well. And the way that you get that with high intensity, we can go to some of the science of that if you want to.
Yeah, no, I think that's great. And just so you know, that there's been conversations that Dr. Spencer and I have had behind the scenes, not today, but in the past, where he's like, what's your goal with a workout? And so like, I'm aspiring to get some goals specifically, because it'll be like, I want to hit a workout 4 or 5 times a day, and I want to do yoga, or not a day, a week. And I want to do, yoga and hot yoga 2 times.
Right.
And he's looking at me, he's like, but what's your goal?
Yeah.
And I was like, I don't know what you mean. Like, what's your goal? And I was like, well, that I think is different for women just across the board, because I asked patients, just so you know, since then. So I have looked at patients, including not, again, I've looked at friends too, and one of them you may know well. And I said, so what's your goal? And they're like, I don't know what you mean. So it was the same
my wife.
response. Yes.
Yeah.
So it was the same response from women. And I basically said to look good in and out of clothes is like, it's pretty simple for women, because he was trying to say like VO2 max. Do you want to see that improved? Do you want to decrease your time, on your mile run or whatever it was? But it was just really simple. For every woman across the board, it was the same. Just
Yeah, I
so
just
you know,
wanna
I
look
did my
better
own little study.
I
Yeah,
want to look better in a bathing suit.
in and out of clothes. It
Yeah,
was across the
so-
board. Yeah, the answer.
Which is a goal. I mean, so if we can translate that into something objective, like I would like to lose 5 pounds and set it at 6 months, I think then, so, I'm much more of a objective kind of guy, mechanistic kind of guy. And so I want to be able to have a goal so I can create a plan and I can work that plan and I can check and see if that plan's working. If not, I need to change that plan. You know what I mean? And it may be that I want to increase my squat by 50 pounds. And so I need to know how to get there, right? Or I want to increase my heart rate variability, and I measure that on a daily basis. Is what I'm doing actually making a difference? And it may be a difference between guys and girls. I mean, I think guys want to look better in a bathing suit too, but
They do,
it's a little different.
And I don't think that it's anything wrong. I just thought it was a perspective change for me. And there's many times in life where there's just like a quick perspective change, because I never thought about it before. But when he asked, it wasn't just one question. It was like, but no, what's your goal? Like, is it specific? So it actually did make me think about it, honestly. Like, and then to start developing some of those, like little miniature goals. But also, we have an InBody in the office now. So even doing body composition and having numbers, where you have lean mass in the arms, the core, the legs, and you can compare that over time, was a good start. And we started doing that with our patients too. So
That's great,
yeah.
because that's then something objective they can look at and see, is my program working, whatever I'm doing here.
Yeah.
If not, let me change this program, add something in, subtract something else. And that's a good thing from a longevity standpoint too, because our VO2 max decreases over time. So if you ask someone, hey, what's your goal when you're 70 years of age? I want to be able to, run a 5K. Well, it's going to require this kind of VO2 max in order to do that. Here's where you are right now. I don't know if you're going to make it when we have this 10% decrease over every decade. So we need to up the ante right now.
So, and even talk a little bit about VO2 max for even just a moment, because again, I think that's a newer concept across the board. I do have a Garmin now, so like it's not as if it doesn't have that on there. But talk for a few minutes about that, and even then the HIIT, because just talking about how that high intensity helps and improves as we get older too. It's more important.
Right, and so the high intensity workout, I think, is so much of a better workout in order to be able to increase your endurance, even more so than doing long duration zone 2 cardio. Zone 2 cardio is just what they call conversational cardio.
Correct.
So probably around 60% of your maximum heart rate. And in general, you can calculate your maximum heart rate, 220 minus your age, and that's your maximum heart rate. So a high intensity interval training, the HIIT workout, would be probably getting 8 sets of tickling that maximum heart rate, okay? And so that'll be different for different age groups, but you want to be able to hit that and then let it bounce back down, probably decreasing by 40 or 50 beats, and then pump it back up and do that for about 8 sets. And what you're really doing is training your muscles to get rid of waste, because once you get to that point where you're at the maximum heart rate, you either stop, like when you're doing VO2 max training, you either stop because you're fatigued, or you stop because you can't go anymore because you just can't get that oxygen. You can't, from a cardiovascular standpoint, you can't go anymore. And that's going to be different for each person depending on their level of fitness when they're doing a VO2 max test. But it's when you're doing that anaerobic exercise and then letting it get back down to normal levels, it's more about waste management than it is getting enough oxygen in there. So I'll get a little sciencey here. So for the first 10, 20 seconds, you're going to be burning creatine phosphate, and that's a 1-to-1. So you're not going to get much burn out of that, right? So that goes away pretty quickly. Now you're utilizing the glucose and the cytosol. You got about 2 minutes of that. And then you develop so much free phosphate, so much acid, and I'm not sure why you feel the burn. I don't know if it's the lactate, if it's pyruvate getting converted to lactate, if it's the hydrogen ions, is it the phosphate, the free phosphates from the ATP being cleaved, or what it is. But what that does is it creates a stimulus for angiogenesis. So then you get more blood vessels in there because your body's realizing, I got to get rid of this waste. I can't go anymore because I've got too much waste. It's not I don't have enough oxygen. It's not I don't have enough energy. It's I've got too much waste. I got to get rid of this. And so when you slow down, then you get that waste out of there. But then you're increasing the angiogenesis to those muscles. And so then your endurance for the long term increases.
I think that was a great explanation. That was awesome. Because again, in angiogenesis, like over and over again recently, and I don't know if there's been more online, because obviously we're talking about good angiogenesis always when we're talking about it with any kind of fitness, nutrition, like regenerative stuff. We're talking about increased blood flow in a good way to an area, not new blood vessels, pathologic to some area, because I think there's been a lot of questions for me by patients in the office, like, well, I'm worried, is an angiogenesis like a bad thing? And what we're actually talking about is increased blood flow to an area that's actually good. You're just increasing the blood vessel health in an area. Yeah. And that's what we mean by angiogenesis. So.
Right, and the nitric oxide synthase goes up, so the diameter of the vessel increases, correct. The permeability increases, its ability to exchange CO2 and oxygen, because that's really what we're doing there, that increases. So yeah, just to your point, angiogenesis to the muscles is good. Angiogenesis to a tumor, bad.
Bad, yes.
And there's a drug called Avastin, which actually inhibits vascular endothelial growth factor. So when I'm talking to patients about the potential use of peptides, especially like thymosin beta-4 or BPC-157, which both can increase VEGF, you have to make sure, at least I make sure, that you don't have any cancer that you know of,
Correct.
and it's a short-term thing that you're using that for a healing process, not something that you're going to take long-term, because the last thing you want to do is stimulate VEGF if someone has some sort of cancer. And there may be cancers that you don't know about, but
I'm
in
sure that
general,
there is for
and
the
we don't have
most part.
markers
Yeah,
for all
yeah.
the cancers, so
Yeah.
you're honestly not going to know that. But for short-term, that's a good thing. But to your point, you don't want to just indiscriminately increase VEGF,
Yeah.
but for exercise-induced increase in that is
Yeah.
absolutely fantastic.
Yeah, and I would say that even BPC has been brought up multiple times when they ask about that, even in healing and muscle and cartilage, and again, you're talking about an increased blood flow to an area for healing purposes and for a reason. But yes, I agree. No solid tumors can use anything that potentially increases growth of anything.
Right.
Yeah.
And for tendons and ligaments, it's especially important to increase the angiogenesis because tendons get their blood supply from the muscle and from the bone they attach to, right? And if you look at the Achilles tendon, that's a really long tendon. And in the middle, it's kind of a watershed area where you don't have as much vascularity. So if there's something that you can do to increase the vascularity, increase the nutrients going there, then you're going to increase the ability to heal. And it works really, really well.
There was actually, and this is just a quick side note about it, but there was a recent study that actually Huberman talked about it on his podcast about Achilles, like where you're almost like you're just doing calf push-ups essentially, and somebody stationary, or a stationary job sitting a lot, where they just do calf push-ups essentially. They had a prolonged period of time ultimately that they were doing them, but an improved insulin sensitivity with it. And so if you're just thinking about while you're sitting just to basically lift, and it increased sensitivity of insulin across the board, and maybe potentially also growth and even a increased blood flow or muscle growth there, that's just a really simple thing people can do if they're just sitting.
That sounds a lot like NEAT, non-exercise activity thermogenesis, and so you'll find there are people that fidget. I'm fidgeting with a damn pen, but just doing something like that can increase the like it's called, you're just burning calories, non-exercise activity thermogenesis. And so there are people that have a huge, they're always tapping their foot and stuff like that. They'll have a huge expenditure of calories throughout the day that people that just are sedentary don't have. And it can be up to 10%, I think, of your metabolic spend in that day. Now, if you're a real fidgeter or someone that's pacing around all the time, then you might even expend a lot more.
Yeah, that's very interesting. Love that part because that's just something simple that people can do. Also intentionally, even if you're not a fidgeter, just intentionally to increase. So it sounds like, again, fitness you're talking about. So when you're talking about surgery, and if we were to get in particular, talk about protein intake, because obviously protein intake's great across the board. And so, and I don't think we actually we learned nothing about nutrition in med school. I would say essentially nothing. And
I agree.
And so you have to take an active interest in it at this point, because they're still probably not learning, at least from what I hear, anything about nutrition. But protein intake and a specific gram per pound of protein per body weight, and then that increases with surgery, stress on the body, healing, and even age. So what kind of guidelines do you give them, from that protein intake aspect?
In general, about 1.5 to 2 grams per kilogram. And to put that, an easy way is just a gram per pound.
Okay.
And you're going to reach that protein intake. And it's, egg is probably about 7 to 8 grams. And then a good chicken breast is probably about 30 to 40 grams, depending on the size of the chicken breast. So that kind of gives you an idea. And then on the packages of your protein bars, it'll tell you how many grams of protein that you're getting. So that's what I would go for during the day. Now, I'd like to take BCAAs as well because leucine is one of the BCAAs, so it's leucine, isoleucine, and valine, they're the branched chain amino acids. And leucine really drives the protein synthesis in the muscles. And so the more leucine that you can take in, which is in chicken, it's in steak, it's in eggs, but in the branched chain amino acids, you can really drive that leucine in there. And it's actually passively diffused into the muscle. So you don't have to actively transport it, whereas the other aminos are actively transported. Leucine is so important that it's passively brought into the muscle cells and stimulates protein synthesis in the muscle cells, which after you're working out, that's what you're wanting to do, right? So that's why I think getting quite a bit of leucine in, if you're wanting to build muscle mass, is a really, really good idea. And in general, there's a huge thermic effect of the burn that you get with protein that you don't get with fat. Like the thermic effect of food for fat is like 3%. So if you had 100 calories that you took in fat, you're taking in 97, right? Carbohydrate is somewhere around 8 to 10% because that's got to be phosphorylated before you can actually burn it. Protein, if you're going to burn it, we don't burn a lot of protein. We don't have stores. We got stores for fat. And we got stores for carbohydrate, right? We store that as fat. We don't have any storage system for protein. We've got free amino acids running around in our bloodstream, and we've got muscle. But who wants to burn muscle as a fuel, right? That's the last thing you want to do. I'll burn fat and carbs before I'm going to burn any muscle. So if you are going to burn the protein, then it's got to be deaminated. It's got to be phosphorylated. And so 20% of the 100, let's say you take in 100 calories of protein, 20% of that at least goes into burning the protein. So your effective gain in those calories is so much less. And so that's why a protein diet, and that's why the carnivores really support the protein diet, that you're not getting all the calories that you take in by mouth. What you take in by mouth shouldn't exactly be counted against you. You know what I mean? So that's why you can get that
And
burn
then
there.
even with that, so like free amino acids, or the branched chain amino acids important with that. So just tell me, what is your take about timing of protein? So for a workout, for instance, not necessarily surgery, because there's mixed, you know, mixed thoughts on this because I've heard before, after, and then I think next we talk for a moment about creatine, as that's hugely important too. But do you do it before or do you do it after?
It doesn't. I don't think it really matters. There was a school of thought that 30 grams of protein is all you can take in at a time. That's not true. You can take in protein the entire time that you're eating afterwards. I prefer to work out on an empty stomach. Some people like to have some food beforehand. If you take in carbs beforehand, you're going to be burning those first, and that's perfectly fine. But you'll get a little bit more fat burning going into it fasted because, especially if you're doing more zone 2 cardio. So if you're doing HIIT, you're going to burn a lot more carbs because you're burning a lot of that glucose and the glycogen then in the muscle. If you're doing more of a long endurance run, then you're going to get more of a slow burn from burning the fatty acids because they just take longer, like to beta oxidize that. It takes longer to burn, so it's a more effective burn because it's more efficient. For a 6 carbon fat, you're going to get, I think it's like 46 ATP out of that, and it's 38 out of a 6 carbon carbohydrate like glucose. And so it's a much more efficient burn to burn fat, but it's a much slower burn. And so you will burn on a more slow exercise, that you'll get into fat burning a lot quicker than you will with a high intensity. But kind of ran off on
Well,
where
I
the
was
question
thinking,
was.
so one of the, like, again, I try to make
Oh, whether you eat
more,
beforehand or
yeah.
not with the protein. Yeah, so the eating, there's really not a timing that you have to do. I usually have branched chain amino acids, so I have an electrolyte drink as I'm working out, and then afterwards what I'll do is I'll start drinking the BCAAs at that point, and then I'll eat a protein bar, and then I'll drink my smoothie. And so I just kind of get a continuous more infusion of protein. But whether you take the protein in within an hour or within 4 hours, it really doesn't matter. The first 4 hours is actually the transcription of the need to create protein synthesis. And so at that point, the DNA is churning out messenger RNA, and then about 4 hours later, you really start trying to kind of transcribing that into proteins, and so it doesn't really matter. You
So
don't have
really
to.
after, if anything, because I think one of the trainers, which again to me, I try to make it at least make sense, so I don't have to memorize something specifically to explain to patients. So the way I understood it, anyhow, which kind of made sense, was that if you were doing a muscle building resistance training and, a high intensity one, like where you're really lifting, to potentially take in carbs if you were going to take it beforehand, because then you're not burning, glycogen and potentially using, or was it carbs? Yeah, no, because then you're using those carbs for your energy strictly with the workout and then do protein after, but again, if you're into a fat burning mode, which is not muscle building, which you're doing with resistance, then going in without any calories is best, because then you're going to burn the most fat. And so anyhow, but that was just a simplified, which made sense because I was trying to decide, and every single person and every single thing you read or watched had something different. So essentially, you're saying the 4 hours after, for sure, you're going to end up building muscle. So you need to take protein in at some point if you're doing resistance training or HIIT workouts.
Correct.
Right?
Correct. But whether you go into it fast or not, probably it changes whether you're going to be burning more fat, burning more carbs. But then afterwards, when you're restoring the glycogen stores, because for sure you're going to be burning glucose, right? And you're going to be using up a lot of the glycogen in the muscle. It's going to have to be restored, and so that's that post-exercise oxygen consumption, because you've got an oxygen deficit. Your mitochondria are going to be replacing all the energy, and your body's going to be replacing all the glycogen, and so you'll get a long burn after that. And I don't know, whenever I do a leg workout, I'm like super hungry. I could eat a bear, I think, or something afterwards.
Yeah, me too. It's extreme. I'm just kidding. Like,
Yeah, but
remember, it's my goals. It's my lack of goals. But like again, no, I mean we do resistance training, but I don't think I'm doing it nearly to the intensity that you are. But I think that what I'm hearing overall is you're not going to burn any muscle or break down muscle, period, because it takes way too much in the way of energy and way too long. And so you just need to make sure that at some point after, you're taking in enough amino acids and BCAAs, specifically leucine, and then protein and calories.
Yeah,
Right.
and it's dealer's choice whether you go into it fast or not. I don't like if I eat, I'll tend to get like a stomach cramp when I'm working out. So I in general don't, but I don't think that it matters that much. It's more what you
Yeah.
consume afterwards, which you really need to have increase in protein, especially the branched chain amino acids, in order to build, if that's what you're wanting to do, but also to repair. And you mentioned creatine. I think creatine's a really good supplement. I don't think there's much downside to creatine unless you have like really bad renal disease. But other than that, creatine's actually been shown to improve memory, cognition, muscle recovery, muscle strength. And so I haven't gone without it in a long time. So I've not, I can't tell if it's doing anything right now, but I'm sure that it probably is. And certainly it's your first burn when you're working out. That's the first 10, 20 seconds of you burning is the creatine phosphate.
More energy for
Yeah.
the workout and more ATP, all of that. So again, kind of anti-loading data now, like where people aren't talking about loading as much, just 5 grams a day for the most part across the board is what
Yeah.
my takeaway. But it does have tons of cognitive and health benefits overall, like insulin sensitivity, better for lipid panels. Like there was just a ton. They used it for fertility in the past. Like it's amazing what they use creatine for.
Yeah, it
and what it's been
actually,
studied.
I think there's at least a couple reports that show that it improves the conversion of testosterone to DHT, which is kind of the working horse there of testosterone.
Yeah.
So.
Yeah, no, it is. There were benefits. There were about 20 of them. And so at the end of our podcast for creatine, again, I was like, why am I not on this? Because I was always thinking it was more of like, if you were into, maybe competitive sports or bodybuilding, that everyone was on creatine. But I was thinking it was more of a extreme, sport or muscle building, but it's not. The
Right.
cognitive benefits are just huge and far-reaching. So, And so is there anything that you think we haven't, covered when it comes to, because obviously, in just summarizing, you know, overall lifestyle habits matter, period, for us, for longevity, definitely with surgical recovery and stress of the body with an injury or surgery. So, fitness, something that you're consistent with, definitely setting goals. Don't forget about that. I'm working on that one. And then again, nutrition, but something that you can do consistent that's healthy and consistent, not necessarily trendy, but something. And really, it comes down to what I'm hearing is healthy eating, increasing protein, fish if possible too, because that has omega-3s in it. But, and then ultimately, supplements being after that, and then everything else being, after that. Like, so you've got to start with something that, again, they can partner with or we have control over, because we only really have control over ourselves. And so again, whatever we're doing on a daily basis are those habits that ultimately affect, how we live, the quality, right? How healthy we are during, a longer period, hopefully, on the earth, but also, health span during that time frame. So is there anything that you like? So you send your patients home with a guide, and then you have a website that is packed full of information that really deep dives into everything you sent them home with, right?
Right, so they can go back and review that. We've got a functional medicine tab where it has a lot of that stuff on there. I don't think it's got the new article on the science of diet, but it goes over a lot of what we talked about, just like you said. So you have to be consistent with your diet. Choose something that is going to be appetizing to you, something that you would actually enjoy doing, and maybe do it with someone else, so there's some accountability. Same thing with the exercise. You want to do something that is actually enjoyable. I do think setting goals from a nutrition standpoint and from an exercise standpoint, I mean, from a nutritional standpoint, you can look at the numbers. You can look at your triglycerides, and it's not all about the triglycerides, but it's all about the ApoB and the LDL, okay? So you can look at those numbers. And what I'm doing, is this making sense? Is this helping me? And it's not a month to month thing. This is, every 6 months. What am I doing? Is this making sense? Is this working for me? Same thing with my exercise standpoint. And then, like, as you said, the supplements. But I think creating goals will definitely help you. And every day it's a challenge. And we haven't even talked about spirituality and how much that's important in your life, your emotional health. We're talking about something that's objective and measurable, but the emotional side of your health, for your health span, both of these things are going to improve your health span. But if you don't have the emotional component in there, if you don't have connection with people, for me, it's doing quiet time every morning and spending time with the Lord. If I'm not doing that, then I'm not set and ready to go. That's the number one thing I do, and then the rest of it falls into place, right?
So no, I agree. Multi-dimensional for sure. We had a podcast guest on yesterday, and we were talking about just the stress that the body might experience, and this guest had a cancer in the past, and she was just talking about something that went back to her youth that she had not let yet go of, and how relieving it was once she did. So, like, again, just that underlying, effects on the body that we don't even think about. And however that works for the person in particular, it could be meditation, it could be, again, religious, time with family. But I think that's all important. Yeah. 100%. I love it.
Covered a lot.
I know we covered a lot for sure. So
you have to break this down.
I know. Well, I can't wait to read the article once it comes out in City View as well, because that'll be, again, I think a huge piece for everyone, to see just how that all ties into, overall longevity. And then I thank you for being on the podcast again. It's always a pleasure to have you on the podcast. And again, we will set up another time and another topic, and your choice, of course. And,
so to you. But thank you very much. I always enjoy this. It's a lot of fun just to kind of banter back and forth and just kind of let things just organically go.
Yeah, no, I agree. So again, leave comments, like, subscribe, and share with friends, and let us know what you want to hear more about, because we are willing to dive deep into anything wellness or sexual wellness.